All right, so we're going to get started. My name is Rodrigo. I'm part of the COVID-19 team. We're in this workshop, Understanding and Exploring Network Epidemiology in the Time of Coronavirus. Thank you very much to the organizers. So the title of our work is The Effect of Voluntary Distancing Measures on the Spread of COVID-19, the Case of Mexico City. So what we have been working on pretty much is the spreading of this disease has been thought to be driven by direct person-to-person contact or indirect contact through airborne. So what we wanted to see what was the effect of the lockdown in the diminishing of the spreading of the disease. And to do this, we considered that there are some people who are able to contribute to this lockdown measure, and so they would obey or cooperate, as we call it here. Of course, we do not mean to make this a punishment or a negative comment about these people, but just some people who are essential workers cannot actually follow this instruction, so their contacts may actually even be increased. So what happens with the fraction of these cooperants or not cooperants? Well, the spread of the disease can be modified depending on the fraction of them. So what we wanted to see was how does the system behave in response to the fraction of cooperants as the total number of cases diminishes if we have more people cooperating. So we wanted to have a qualitative or as possible quantitative measurement of how the effect of the fraction of cooperants would affect this. So to do this, we used different data sets from mobility, demographics, and healthcare systems to try to model this in Mexico City. So I'll pass it on to our colleague here, Diana. Up. There. All right, so I'll keep on going on this one. I think Diana's having some issues.
Yeah.
So in our case, we were trying to focus on Mexico City, not only because of the big amount of people that live there, but because of the big amounts of mobility that there is in the city. So as you can see, Mexico City population by district here, there are some districts that have over 140,000 people. And all of these districts were covered by a survey called Origin and Destiny, which we are using as the source of our mobility data. If we go to the next slide, you'll see that the mobility data that we have been using is, there you go, was taken during 2017. So we're using this as a reference as before the COVID-19 mobility state, and we have this adjacency matrix, and you can see both short range and long range traveling distances that were surveyed throughout this this method. So this is the database that we're using. This next slide, we can see that since COVID-19 and since the imposition or the implementation of these non-pharmacological measures, there has been a diminishment in the mobility to certain kinds of destinations, whereas residential has increased. So we're using the data from Google and the PNAUD grant data source, in which they show the visit and the length of stay at different places compared to a baseline. You can go to the next one. And so in this case,
Hello.
Yep. Are you there? Okay, go on, Sandra. Yep, go for it.
Okay. We are working on two data sets before COVID mobility reduction reported by Google and PNUD grant data. The first one, Google released a dataset report of movement trends over time by geography in 6 categories of places. You can see in the graph the y-axis data about the amount of reduction of mobility, and the x it's the before slide. The slide before, please, Rodrigo.
It's
okay. Yeah. Okay. This is. You can see the reduction of mobility that Google provide for us, and in this they compare with a baseline the reduction of mobility, and the data representing approximately 2 or 3 days ago. It's kind of delayed because this is how long it takes to produce the data set for Google team. So in the next one, in the next slide, please. On the other hand, we have the data set of PNUD and Grandata project. They provide a data set of mobile user, and basically they highlight the percentage difference of out-of-home events performed by individuals. They measure an average number of users in the data set per day. I think in the case of Mexico, they has 1 million of unique users per day. In Zoom, these two data sets provide a location history baseline in the case of Google. And this data depends on the user settings, connectivity, and privacy. Grandata tools work with more events than Google and only report pre and post quarantine from March 1st, 2020. So this tool is not enough for the model, but we can compare the data released on the reduction of mobility in order to look into the impact on mitigation strategies, on MPIs as mandatory social distances and other measures. And this data could contribute with the agent behavior and cooperation within the model. We also work on different open data sets about historical mobility in Mexico City as well, through the inflow of people in transportation. And this a survey on origin and destiny that described the daily movements of the inhabitants of Mexico City by districts during the 2017. So that will be the two data sets and in mobility reduction.
Okay. So Memo?
Yeah. So the other source of data that we wanted to use was the actual incidence data on COVID. And the Mexican government has been releasing these data sets. Originally, they were just presenting them on a daily basis, but now there are open data sets in their website, so they can be downloaded and analyzed. One thing that we wanted to do was to calculate all the epidemiological parameters to feed our model, but soon we found out that there were some issues that we need to fix. Mainly, there is no single identifier of the cases that can be used to track when they are added to the daily counts. So can you go back to the previous one, Martin? Thanks. So what we found is that if you look into the date when a case is added and you compare it to the date when the symptoms started, we are having a report delay of about 10 days. Now, the next one, please. And the other issue that we have is that the number of cases associated to an initial date of symptoms start, which we can use as sort of a measure of when the disease started manifesting, it increases through time. So we are still counting new cases that that started having symptoms 2 or 3 weeks ago. So until we figure out how to identify this growth, we haven't been able to properly calculate the epidemiological parameters to feed the models that we'll be discussing now.
Okay, so we've been trying some simulations with an agent-based model. So in this case, in this model, we, as my teammates have already said, we try to transfer this mobility data into an LFR model. So this is the basic heterogeneity in the model, and there are some preliminary results. So we modulated the cooperation probability, and so as more agents are more willing to cooperate, the size of the infection reduces, but also the number of susceptible agents increase when the cooperation probability increases as well. So yes,
cooperation reduces the number of infections, but also increases the number of susceptible agents at the end of the pandemic. So some herd immunity strategies could be compromised. Another thing is that also the cooperation probability allows to reduce the number of simultaneous infections, which could be important to not overload the healthcare system. And well, those are the preliminary results, and what we are working on is in incorporating more base data demographic information into the agents, and to better translate the mobility data to parameters in the LFR network, and to model in some other ways the cooperation probability. That will be it. Thank you.
Thank you very much.
Sorry for the...
No. So for everyone, since we only have 3 sessions here, we actually have a little bit more time.
Oh, right.
So I'm going to open it up for questions.
Yeah, sure. I guess no questions.
Can I ask a question?
Yeah, sure.
What was the most challenging part of this project?
Well, right now, the most challenging part is transferring the database. Well, the data we have about the cases and all this mobility, to incorporate them into the agents-based model parameters. So actually, we are still working on it.
Interesting. Okay.
Yep.
All right. Thank you very much.
You're welcome.
And we're going to move on now to dampened weather, dampened COVID-19 curve, an observational study, part 2.
All right. Hello, everyone. Let me get my screen set up for you all here. Okay. Are my slides present now?
No.
No. All right. 1 second. Okay. How about now?
Yes.
Okay. Perfect. All right, everyone. Thank you for this opportunity again to kind of share with you my follow-up to some preliminary work that I've been looking at as far as exploring the role of weather on COVID-19 cases. I think from last week, I kind of just showed some very initial, very rough sort of analyses. And this week, I kind of hope to share with you some more data robust results, and also primarily looking at the role of temperature and rainfall. Just for those of us who happen to live on the East Coast of the United States, we're actually kind of experiencing a pretty severe system that's occurring. So far, at least here in DC where I reside, there's already been about 13 millimeters of rainfall, and I think it's only barely 130 currently. So this kind of helps kind of frame the picture as far as the role of weather kind of living in the time of social distancing, and also kind of the different sort of, or kind of also considering the relaxation of some of these policies to help curb COVID-19. Just so you know my background, I have an environmental epidemiology background, looking primarily at the role of climate and sort of environmental hazards on human health. So there's been kind of a lot of work that's been done looking at the role of acute environmental exposures, such as weather, extreme heat, rainfall, but also looking at other sort of exposures like air pollution. So, and the idea is that all these sort of environmental exposures do happen to have some sort of relationship or linkage to human health. As I think the previous seminar speaker kind of alluded to, that there's some sort of containment that can be done with respect to our living proximity and quarters. But I think one of the things that maybe should also be bared in mind is also the role of potentially weather, and how that could increase or potentially decrease mobility within a population. So an approach that I use that's been kind of gaining a little bit more momentum for this type of question is using something known as distributed lag nonlinear model, which is able to kind of model out some temporal complexities with respect to an acute environmental exposure and some sort of health outcome or event-based health outcomes such as mortality or cases. So the use of DLNM is able to model that association between a lag value with respect to some sort of lag exposure up to some sort of predefined maximum lag value. So if I'm interested in, say, in the role of a hot day on, say, my hospital, potential admission to a hospital, I could look at multiple days after I experience that extreme heat event, say same day, 1 day later, 2 days later, etc. And we're able to do this using some very complex sort of time series model specification. We're able to kind of use something known as cross basis function, where we're able to model out both the exposure response along the x-axis and also lag responses along the y or the lag axis. And there's different type of functions that we can use to fit these sort of exposure and lag response fits, whether it be linear or more complex, such as nonlinear, as the name denotes, or like such as splines. So this right here is kind of an example of a figure of what we might anticipate or see with an output that is able to model out something known as the exposure lag response. So we have here along this axis temperature, and along this axis here lag, and then up here on the Z we're able to see the RR, which is known as the rate ratio or the relative risk, which is kind of a common sort of measure of association used in public health to determine the risk of potential exposure or the potential likelihood of, say, contracting a disease, and in our case, COVID-19 cases. So to do this analysis, I was very fortunate to have some ample data available, especially our COVID-19 cases through Johns Hopkins Center for Systems Science and Engineering. I was able to extract out very fresh new data through their console, and I applied a 5-day average, rolling average to each day with respect to the number of cases new cases that have been reported, namely just to account for any sort of sudden sort of volume of test kits that may be available to the specific location that we're looking at. And also, I was assuming an incubation period of 2 to 14 days. And this is kind of important because with respect to lag structures, we want to be able to see what might be the impact of a bad weather day or any sort of weather event that could have in terms of predicting the risk after, say, someone may have been exposed to or potentially exposed to COVID-19. And with respect to weather data, I was able to extract data through our National Ocean and Atmospheric Agency through their climatic data center. And then as far as my regression fit, I don't have a network or dynamic mathematical modeling guide. I'm kind of like your very run-of-the-mill environmental epidemiologist. I basically do a lot of frequentist sort of approaches. So we used a quasi-Poisson regression, and we corrected for time varying variables such as the time and day of the week. And we applied a 30-day lag, natural spline fit for the lags, and we spaced the knots at 4 equal space knots for the lag dimension. And just to give you a little bit of appreciation as far as the summary statistics, so I looked at 5 cities, namely just because at that time they had the most data or reported cases, and plus they had this very unique sort of eco-regions, so DC, New York, Los Angeles, Miami, Philadelphia. And then starting with precipitation. So we see here two 3-dimensional prediction curves for Miami Dade, and Los Angeles. And kind of like with the original slide or example that I showed you, we're able to see rainfall as our exposure lag, and then kind of our rate ratio or relative risk here. And we kind of see we have this sort of ridge sort of approach. So it's interesting, but we can't have much information as far or more fine scale sort of information that we're able to extract from. We just kind of appreciate its trend. So for this, I basically apply some cross sections where we're able to look at rainfall, and rainfall is kind of represented at the 95th percentile It's kind of it's more of a statistical sort of normalization that I applied just to get an appreciation as for how these trends look like. And we're able to see with both Miami and LA that up to lag 15, we see this sort of increase in terms of risk of COVID-19 cases, but then we see this drop off after lag 15. And assuming that there's a 2 to 14 day incubation period, we're kind of seeing that there's kind of like this sort of like fall off with this upside down U curve. And this might suggest, very preliminary, that rainfall, at least with these two locations, might have some sort of effect with respect to the number of cases or potential cases that may be contracted within these two locations here. And then with respect to New York City and Philadelphia, both cities probably higher density with respect to these urban landscapes here. We didn't see much. There was variations kind of wide, way too wide. You're able to kind of drive through these. So for now, at least with the data that I have available, not much could be made or inference could be made, but we can see at least with the curve, central tendency curve, we kind of see that there's a similar-ish sort of trend that we've seen for LA and Miami. And then for DC, where I reside, we do kind of see this sort of upside down U curve, but again, kind of wide sort of variation at kind of later lags. Then with respect to temperature, I looked at minimum temperature at the minimum percentile or 10th percentile, kind of denoting cold weather. And each location has its own sort of 10th percentile. We're able to see across Philly, New York, and Miami, again, very wide variation. Probably more data needs to be used to kind of be able to see something probably significant, or there's probably not much significance at all. But with respect to temperature for Los Angeles is definitely the naughty location, I guess, if you will, compared to the other cities. And we see that there is this sort of spike. And granted, cold temperature in Los Angeles is nowhere anywhere comparable to where I'm at here in DC, where cold temperature is considerable. In DC, we do see that sort of trend, that spike, but again, I think more data is going to be needed to kind of fine tune, but we do see a similar sort of uptick like Los Angeles. So some quick findings. There's some credible potential sort of association between rainfall and COVID-19, and temperature could potentially suggest something as well, but TBD. We're able to observe trends using these distributed lag structures. Location matters. Unfortunately, the approach that I'm using right now is going to be only location specific. So we can't assume what rainfall might occur, the effect of rainfall might have, say, in Philadelphia will have the same sort of effect in Portland, Oregon. This approach that I can use also could help inform health impact assessments using something called RCPs, representing concentration pathways. So if we were to say look at 2030 or 2040, we could potentially look at the impact that this might have with respect to climate change. And lastly, which I look forward to doing, is basically applying a natural experiment design so we could explore how death outcomes might have impacts with respect to weather. Okay, that's all I have. Thank you.
Thank you. All right, so do we have any questions?
Hi, I think it's a very good presentation. I have some questions regarding the environmental drivers you choose.
Sure, no problem.
Yeah, like for lots of respiratory virus, the potential evapotranspiration is a really important environmental driver. Did you ever consider that?
Yes, actually, I think it would be interesting to look at the role of, say, relative humidity. The only issue, because of the time limitation, I kind of restricted my location with respect to North America, or at least US cities. But I would be interested in looking at the role of relative humidity in the context of temperature. So looking at, because obviously rainy days, you could assume that it's pretty high humidity. But if we're looking at, say, tropical areas where there's both high humidity and high temperature, I think that would be a very interesting thing to look at. Because if we're looking at, say, our friends in South America, in Brazil, for example, where, it's definitely, at least with respect to climate, it's certainly has both of those characteristics, but we're seeing this sort of, similar trend with respect to the pandemic, but that I think mainly has to do with the fact that there's poor implementation, at least from the federal level, of protective sort of schemes. But from my understanding, the provinces there within Brazil has put in place some protective measures. But I think the idea is that humidity could play a role as far as preserving the virus, which unfortunately, while I'm working at, I can't get at that scale unless I have individual level sort of information, but it could certainly inform part of my inference. So, but yeah, no, that's a very good point, and I look forward to using potential to what's it called heat index as a way to kind of address that.
Thank you. And I have another question regarding the time period you use. Normally, when we try to identify the environmental driver, we will use like quite a long period of time. But right now, for coronavirus, we can only use 1 month. Do you think like how this time period will related to the robust of your results?
So, and that's a very good point. I think the strength as far as the study design that I'm using is that because there is such large number of cases that are being reported daily within the last month and a half or 2 months, depending which location you're looking at, that helps a lot as far as kind of address the power for these regression fits that I'm conducting. If I were to say use mortality for my analysis, which I've already kind of tried to, it doesn't, the outputs don't look good at all. They're pretty wide, very, very wide confidence intervals. It's not much information can be kind of inferred from, but targeting locations where there is a high number of cases being reported or high number of testings that's being conducted, that kind of helps overcome the fact that we're looking at this very sort of 1-2 month sort of time interval. But yeah, I think the locations I selected, I kind of are intended to pick those locations because they did have the higher number of cases reported, at least within the U.S. Other locations I would have loved to look at was like, say, in the South, United States, like Mississippi, New Orleans, just because like they've had these sort of explosions of tornadoes and other sort of extreme weather that may help address another question as far as like the role of these sort of catastrophic sort of storms and its potential risk of contracting COVID-19.